Okay, this is the SOT video steps 1 through 8. So the first thing I'm going to do is distortion analyzer. I'm going to have my thumb at the level of their AC joint, and I'm checking for AP sway. If it was greater than 1/4 of an inch, that would be a category 1. And I'm going to come back here to the level of the S2 tubercle, and I'm going to use my thumb as a marker. And if he has any lateral sway that's greater than 1/4 of an inch, that would be a category 2. And if there's no sway or an antalgic lean, that's a category 3. Now I'm going to do the first rib. I'm going to have that patient sit down. I'm going to palpate the anterior and posterior portions of the first rib. And I'm going to have my patient flex your head, extend your head, and continue that. And I'm feeling for movement more than 1/4 of an inch. If it's unilateral movement, more than 1/4 of an inch, that's a category 2. If it's bilateral movement greater than 1/4 of an inch, it's category 1. And if there's no movement at all, it's category 3. Now I'll do the cervical indicator, so come have a lace to kind for me. The first thing I'm going to palpate is C3, bilateral laminas. If there's tenderness in that area, then that is a category 1. And if there was tenderness or pain on the left lamina of C4, that would be a category 2. And to determine category 3, I'll palpate all of the spinous processes and transverse processes of the cervicals. And depending on where the tenderness is, it correlates with the lumbar vertebrae. So if it's a spinous in the cervicals, that will correlate to lumbar mandillary being inferior. And if it's a cervical TVP that's tender, it correlates to a rotated spinous in the lumbars. Now I'll do the stair step. So there should be 4 distinct stair steps, and if one is not really present or a little muddled, I would take it there to whatever stair step that was, and I would adjust it by doing a figure 8 motion like this. And then I would retest to make sure that they were all, you know what, I skipped one. Okay, cervical compaction. So I'm going to have you place your hands on your stomach, and I'm going to have you lift your legs 18 to 24 inches. Okay, and put them back down. Now I'm going to compress and ask the patient if that was easier or harder. So since it was harder, he has an issue in the lumbars, and if it was easier, the issue would be in the cervicals. And then you would do the stair step, but we did that. So now the basic one. Now I'm going to use the pads of my fingers to palpate just inferior to the superior nuchal line. And I'm going to be palpating for the pulsations of the CSF. And we're just going to sit here for a moment and wait till they even out and relax. Lots of energy going on right now. And once they're symmetrical, we should be balanced, and that's the goal of that. The next is to palpate his sagittal suture and ask for any areas of tenderness. Should I find an area, I'm going to have my fingers along the sides of his parietal bones, and my thumbs will be crossed on the opposite side of the suture, so that when he inhales, I will push along the suture to open those up, and we'll do that a few times. And then that should relieve him of his pain in that area. The next is the psoas test. So I'm going to have you bring your arms towards me. I'm going to take the patient's arms and I'm going to lean back and stretch them out. I'll then put them together and then show him the inequality in length of these arms, which the short arm would indicate the tight psoas on that side. So I'm going to come to the opposite side. He had a right short arm. So I'm going to have you bend your right leg 90 degrees. I'm going to come around and I'm going to stabilize the ilium. And I'm going to find where the psoas is right here. And I'm going to have you inhale, and then on the exhale, with each exhale, I'm going to go a little deeper into that muscle and strip it out. Okay. And then I'll retest afterwards, and he should be a little more equal in arm length. The next thing is the anterior iliofemoral ligament test. To test this, you check internal rotation of the feet. If they're unequal or one is tight, that indicates a restricted or really tense anterior iliofemoral ligament. So this one wouldn't go in as much. It was pretty hard. I'm going to come on this side of my patient. I'm going to go an inch superior and an inch posterior to the greater trochanter to find this ligament. So, up and back. And I'm going to hook it with my hands like this. I'm going to have the patient start from internal rotation and go out to external rotation as I'm tensing this ligament. And then on the third one, he's going to do it very quickly, and I'm going to thrust. So 1, 2, 3. And then I would retest, and it should be a little more even in internal rotation. Next thing is AFT. Okay, so I'm gonna do a muscle test for your arm. Just bring it to 90 degrees in a soft fist. And I'm just gonna test his strength first. Then I'm gonna test him using touching the points, the superior pole and the inferior pole of the inguinal ligament. So, and I'm gonna do it with like flat 4 fingers. So now I'm gonna retest here. So that was weak. Come to the inferior pole and test again. And that was a little weaker than the first try as well. I'm going to do the same thing on the other arm, so test muscle strength. Now I'll come to the superior pole. And that was weaker. And so is that. So all of those are just, they confirm the category 2 that we were suspecting before. And that's it. What is this?
Trying to get it to stop.
What is UM?